Hello, I'm Joe Massad, and I'd like to introduce you to a new app produced by uniquedentalapps.com. One of the problems we have with our patients, especially aesthetically, is that when we're completed with the case, many times they may complain about something looks like it's maybe showing more teeth on one side than the other, maybe the midline's off a little bit, and yet when they came in, they already had the deficiencies, but we really didn't address it. So we've actually come up with a comparative facial analysis using resting, closing, and smiling expressions. We recommend certain photographs to be taken, and we generally take it with something like this. This is a mini iPad, and you can actually take the photos, which will drop directly into an application, and they will then have a comparison of patients who have asymmetry, deviation of the midline position, and so forth. And the picture that you take will actually go and sit next to it. So let's just kind of real briefly go over that. Frontal view. Have the patient open wide with the mouth and teeth slightly apart without flexing any facial muscles. Now we're going to be able to see, do we have a show of teeth, no show of teeth, or what? Maybe excess show. How about have the patient close, until their teeth touch, whether it be a prosthetic or whether it be their own natural dentition. You will later now then analyze the closed with the open and looking at the freeway space. So you're going to utilize this several times, not just for aesthetics, but also for a few other items. Then we have the patient give us a full smile, okay? And I would like them to have their mouth slightly open, so sometimes exaggerate high, for example. They are going to smile as wide as possible, and now you're going to look at lip position as far as midline, asymmetry. And when we think about asymmetry, we want to look at both the upper and the lower face. So I think that's important, because the one thing we want to do is we want to determine if there is some asymmetry of both upper and lower lips. We also note this as pulling of the lips slightly. Then we'll have the patient turn to the left, for example, and take a side view. So this is a lateral view. That is then going to help us determine, and then with the teeth closed, whether it's a skeletal or a possible vertical class 1, 2, or 3. And then, of course, an occlusal view, full arch maxillary, and occlusal view, full arch mandibular, and any photo suspicious of any pathology. But virtually, when we have these particular photographs, and they will then directly go into the app. And as they go into the app, and if you look real closely, you can go in and you will be able to punch on the patient and their picture becomes large. They could then look at this, and then they go in and take a look at the different choices. Mrs. Smith, it looks like you have no show of teeth when you're slightly open. And when you smile, you may have no show of teeth, or you may have excess show of teeth and tissue. So at this point, the patient and I are discussing all of this together, and it makes so much sense. I want to check asymmetry. I want to check how much tooth shows. I want to check midline position. All this is important. How about the vermilion border? We say, what is the dimension of the lip? Is it a full lip? Is it really just a slightly reduced, or is it minimal? And that happens with vermilion borders. Many times you have a very thin upper vermilion border. And what do? We put a beautiful set of teeth in, and that vermilion border may thin a little bit more, especially as you project and have a prettier smile, but then they may notice it. So why don't we, before we even get involved, we should already know the result before we begin. Let's take the patient as they are when they come into the office and analyze these positions, and then let them see with us. Mrs. Smith, here you are today. I'm looking at you. Your lips a little bit diminished. And then we can actually take a look and say, you have really a class 1 because you've lost vertical spacing. So we can actually determine whether or not, or a class 3, for example, if you have a class 3 and you've lost some spacing, well, Mrs. Smith, I think we could assist you with this. But they get to themselves see exactly their own picture next to a then series of other photographs. At the very end, you now have much more control. Now you can sit down and say, there are certain things I can and certain things I cannot do. I think that it gives us so much power to be able to, before we begin a case, analyze, determine midline position, lip pull position, which is asymmetry, determine whether or not patient is severely overclosed, whether they're a skeletal class 1, 2, or 3. This really will help the patient with their expectations. I think that's extremely important.